The federal government of Nigeria on Monday in Cuba, Abuja, flagged off a national campaign on environmental response to combat the ongoing cholera outbreak in the country. Flagging off the campaign, the Minister of Environment, Dr. Mohammed Abubakar, said the campaign was in response to the growing and alarming rate of current cholera outbreak in the country. Other stakeholders in the environment who were guest speakers concurred with the government on clean environmental solution to the current cholera spread in Nigeria and the need for frequent environmental sanitation across the state.
Indeed, it is a thing of joy to us in Buhari today to see this kind of program being organized in Buhari Area Council. We have all gathered here today to take an urgent decisive step to hold one of the commonest deadly but yet preventable disease in our society, which is called cholera. If only cholera will record the cases of this number and the date, that means there is trouble. Therefore, this figure goes betters by earlier statement about the deadly nature of the disease. Nigeria is currently suffering from cholera outbreak, with many states of the Federation experiencing needs. In the FCT, Buhari Area Council is among the worst affected area councils today. We are here in Bazango to flag off government preventive and control measures because Bazango is one of the communities with high mortality rates. As a responsible administration, we have taken a number of serious steps to stem out further spread of the diseases beyond the communities already affected. Therefore, we ask that the minister who have come to our aid today, we pray that by the grace of God, after this program today, it shall come to an end. Cholera will come to an end in our domain. The Honorable Minister, the invited guests, ladies and gentlemen, let me assure you that whatever the government is able to graciously put in place today will not be only complemented in our little way, but consolidate upon. Therefore, on behalf of the victims and the good people of Buhari Area Council, I welcome the Honorable Minister and his esteemed entourage to the Council on this life-saving mission.
It is with deep sense of responsibility that I address you today at this flag-off campaign of the National Environmental Sanitation Response to Cholera Outbreak in Nigeria, spearheaded by the Federal Ministry of Environment. We are especially delighted that the flag-off of this campaign is taking place here in the FCT, and we welcome most sincerely all of you. We are especially delighted that the flag-off of this campaign is taking place in FCT, and we welcome most sincerely all those who have traveled from outside the nation's capital to be here for this very important event. As we are no doubt aware, an outbreak of cholera has occurred in several states across the country, including the FCT, which sadly resulted in some fatalities in the affected locations. Cholera, we must reiterate, is a very preventable disease that in reality should not occur if the basic requirements of environmental and personal hygiene are maintained. It is therefore quite disheartening to us when an outbreak of the disease was recorded in the FCT in the first week of May 2021. This prompted the immediate activation of the Multi-Sectoral Emergency Operations Center with the appointment of an incident manager and 7 response pillars, while a cholera incident action plan was developed to guide the operations of the team. High-level advocacy were carried out to the 6 area councils of the territory, and public enlightenment and sensitization campaigns were intensified via the broadcast media in all the many languages spoken across the FCT. In addition, letters were sent out to all relevant key stakeholders to intensify surveillance and prompt response of suspected cases, while drugs, IV fluids, consumables, and other diagnostic and medical supplies were positioned in all public facilities and primary health care centers across the territory. Risk communication and community engagement were also conducted in all the affected communities with the active participation of all relevant departments and agencies of FCT, including FCT Ruwasa, FCT Water Board, and Abuja Environmental Protection Board. The FCT Water Board, alongside Ruwasa, conducted gap analysis of the entire water needs of the affected communities and are ensuring the supply of adequate clean water to public in those communities. It is gratifying to report that the cholera outbreak has flattened and remains so in the FCT since week 32 through to the current week 34, with 0 daily reported cases from all previously affected communities across the 6 area councils. The cumulative total cholera cases since outbreak across the FCT stand as 1,286, with a total fatality figure of 77, which gave us 6% case fatality recorded so far. The deaths from cholera across the territory are indeed regrettable, and we intend to inspire our community engagement and innovation efforts so as to ensure that there is no recurrence subsequently. However, I must mention that we all have our roles to play as well. There is the need to maintain personal and environmental cleanliness, as this disease is spread mainly through unhygienic personal and communal habits. I therefore call on our community, religious and traditional leaders, and various social and youth groups to leverage their positions of leadership in the communities to further enlighten and sensitize the citizenry on the dangers of this disease and the need to prevent its occurrence and spread. I once more commend the efforts of the Ministry of Environment on the launch of this national campaign and pledge the cooperation of FCT administration in ensuring its success. Thank you for your valued attention, and may God bless you all. Thank you.
I am here today to formally flag off the elevated campaign on the national environmental sanitation response to the ongoing cholera outbreak in the country. The seriousness government attaches to the outbreak is underscored by the collaboration and partnership between the Federal Ministry of Environment and other stakeholders, including the Federal Capital Territory Administration, Federal Ministry of Health, Water Resources, Agriculture and Rural Development, Buhari Area Council, Nigeria Center for Disease Control, Abuja Environmental Protection Board, and the various state governments in responding to the scourge. This is also demonstrated by the presence of all critical stakeholders at today's event. As you are aware, Nigeria is currently experiencing cholera outbreak in several parts of the country, with reported cases of fatalities. A recent situation report from Nigeria Center for Disease Control, released on 17 August 2021, indicated a total number of 37,498 suspected cases, including 1,149 deaths in 23 states and the FCT. And with increasing number of new cases in some states such as Zamfara, Bauchi, Kano, Gombe, Plateau, Niger, and Abuja, the FCT. It is against this background that today's event is organized to flag off our elevated response activities to the increasing rate of spread of cholera cases across the country. Sensitize the general public on cholera preventive and control measures to avert further outbreaks, and strengthen collaboration with NCDC and other stakeholders in tackling the scourge. Cholera, which is a sanitation and hygiene-enabled disease, is an acute diarrheal infection caused by ingestion of unwholesome water or food contaminated with the bacterium Vibrio. Cholera outbreak is a seasonal public health phenomenon in Nigeria. It occurs annually, mostly during the rainy season,
and more often in areas with poor sanitation and hygiene practices. Over the years, the Federal Ministry of Environment, in collaboration with stakeholders, cutting across government at all levels, including the organized private sector, non-governmental organizations, community-based organizations, academia, and development partners, has taken steps to deliver adequate sanitation and hygiene services to the citizenry. These measures include development of policies, regulatory and legislative framework, implementation of relevant programs and projects, and establishment of relevant regulatory and enforcement agencies, among others. This year's outbreak is very serious and has continued to ravage many states with more fatalities being reported on a daily basis. In responding to the recent cholera outbreak, the Federal Ministry of Environment immediately activated the sanitation desk in the 36 state ministries of environment and the FCT, urging them to carry out environmental sanitation activities in their various states aimed at containing the outbreak. I am also glad to note that environmental health officers in the states and local governments across the country have intensified their efforts in carrying out sanitary inspection of premises and abatement of nuisances that will result in cholera outbreak and other diseases such as Lassa fever, yellow fever, smallpox, and the likes. I equally urge all segments of the society, including community associations and leaders, youth and women groups, faith-based organizations, religious leaders, traditional leaders, professional bodies, development partners to take sanitation and hygiene issues as their personal and collective community responsibility by getting involved in sanitation and hygiene issues. At this juncture, I would like to inform you that with this flag of exercise of the elevated National Environmental Sanitation Intervention Response to cholera outbreak in Kubwa, which is currently the epic center in the FCT, the Federal Ministry of Environment, in collaboration with relevant stakeholders,